Today, I'm going to talk about how to pick the right Medicare plan in Virginia, especially when turning 65. These are going to be some questions that you need to answer for yourself to determine the right Medicare plan for you. Hi, I'm Chris Prang, licensed insurance agent based out of Charlottesville, Virginia. My goal is really simple. It is to help you make a wise and confident decision about all of your Medicare choices. I'm also licensed in other states, which you will see that list at the end of the video. So let's go through some of these questions that you should answer for yourself. The first one is, how is my overall health? How are you doing? How is your health? So if you are excellent health, if that's how you would rate yourself, meaning healthy and fit with no issues, then you are someone that can explore both Medicare supplements and Medicare Advantage plans. Or would you describe your health as fair? And by that, I mean you have some minor but stable health issues. You rarely go to the doctor, but you could improve your health. If that sounds like you, then you can explore both Medicare Supplement and Medicare Advantage plans. You will need to make sure that you have good prescription coverage and you understand that you may need prior authorizations for certain procedures and treatment if you do choose a Medicare Advantage plan. And next, would you describe your health as poor? You have some serious health issues and you go to the doctor frequently. You may have cancer, kidney disease, heart disease, COPD, diabetes, Parkinson's, or Alzheimer's. If that is you, then you need to give more serious thought as to whether you should go with a Medicare Advantage plan or a Medicare Supplement plan. Now, my 13 years almost of doing Medicare insurance and sitting face to face with almost 3,000 people, maybe more than 3,000 people at this time, I have found that when it comes to these different health ratings, I would say that very, very few are excellent, 10% or less. I would say that probably 25% at least are poor, and the rest kind of fall in the fair category. The next question you should ask yourself is, am I currently receiving frequent and ongoing treatment for a serious disease? If so, then you should seriously consider getting a Medicare supplement unless you have Medicaid from the state, you have financial assistance from the local hospital where they will write off all of your co-payments or most of them, or you live in an area where a Medicare Advantage plan has a very low maximum out of pocket and it makes sense to get the Medicare Advantage plan. Next question you need to ask is, do I need access to a specialty hospital like a Johns Hopkins in Baltimore, the Mayo Clinic, the Cleveland Clinic? This could be very, very important. If so, you either need a Medicare supplement or really make sure that those hospitals are in network with the Medicare Advantage plan and don't charge you more for being out of network. Here's what I can tell you. If you are on an HMO, Medicare Advantage plan, it's going to be very, very difficult to use it at one of those facilities. If you're a PPO, probably can, but you want to be sure and probably going to end up paying more. Let me read you a couple of things. From Johns Hopkins, please be advised that Johns Hopkins Medicine hospitals and most Johns Hopkins University physicians participate with Medicare, but we are not contracted with most Medicare Advantage plans. If your Johns Hopkins Medicare hospital doesn't participate with a Medicare Advantage plan, you can use out-of-network benefits if your plan has them. Again, if you're on an HMO, most likely can't do it. According to the Mayo Clinic, when it talks about HMOs, Mayo Clinic does not participate with all health maintenance organizations. In addition, an HMO will not typically pay for Mayo Clinic services without prior authorization from your insurance company. Your physician's referral does not necessarily constitute an authorization from your HMO. So if you need access to one of these specialty hospitals and you're turning 65, or maybe you're considering a Medicare Advantage, then you either need to consider a supplement or keep on your supplement more than likely. If you have questions, by all means, reach out to me. Next question to ask yourself, what medications am I taking? These are prescribed medications. We're not talking about over-the-counter medications or vitamins or supplements. We're talking about medications that are prescribed by your doctor. It is critical that you pick the right prescription coverage. Not all prescription plans are the same and they change every single year. This is kind of one of the issues that I have with Medicare Part D is the plan changes every single year and you could be on the right plan this year and they change the formulary and the next thing you know, you're not on the right plan. But you need to find out what medications you're taking because it makes a difference. I use the prescription calculator available at Medicare.gov. Anybody can use it. It's free to use. It's a great resource. It's the best resource Is it 100% accurate? I certainly don't think so. And the biggest issue you usually have with the calculator on Medicare.gov is around October when it switches to show the information for the coming year, for the following year starting in January. I've noticed a little bit more glitches and errors during that time. But that's what you want to do. What medications am I taking? When you contact me, we review all that. I use the Medicare calculator to determine the lowest overall cost plan for you. Next one, what doctors and providers am I seeing? Hopefully you know who you're seeing. If you're under original Medicare and you have a Medicare supplement, then you don't have to worry about provider networks. You just need to make sure they take Medicare assignment. Now, 97% of doctors and hospitals accept Medicare assignment. If you're on a Medicare Advantage plan, then it does make a difference. What doctors and providers am I seeing? Well, again, when it comes to Medicare Advantage plan, they have provider network. If you're in an HMO, you must stay in the network unless it's an emergency or urgent care situation. If you're on a PPO, then you can go out of network. More than likely, it will cost you more to do so. Not in every case, but more than likely. And if you're in Virginia, you do not want to get a Medicare Advantage plan that does not have UVA hospital in the network. You may not go to UVA. Hopefully you will never go to UVA if you don't need to. But if you need to go to UVA for something special, you want to make sure that you have no problem using UVA and that you will not be out of network with UVA or won't be able to access them at all if you pick the wrong HMO. All right, next question. Do I qualify for Medicaid or Social Security extra help? If so, then you likely don't need a Medicare supplement. You can stick with original Medicare and get a prescription drug plan, or get a Medicare Advantage plan with extra benefits. Next, do I have TRICARE for life? Obviously, in the state of Virginia, we have a lot of people in the military. A lot of officers in the military live in Virginia or are retired in Virginia and have TRICARE for life. Congratulations, if you have original Medicare and TRICARE, you have the best insurance that you can get. But you can get a Medicare Advantage only plan without the drug coverage, but you may have some issues when it comes to your providers billing correctly between the Medicare Advantage plan, which will become primary instead of original Medicare, and TRICARE, which would be secondary. You do not need a Medicare supplement, that is for sure. In my experience, it's usually best just to stick with original Medicare plus your TRICARE and be done. But if you're interested in a Medicare Advantage only plan and you want to talk about it, see if it makes sense, by all means, give me a call. Next, what can I realistically afford? So let's talk about that when it comes to supplements. If you get a Medicare supplement, your premium will go up every year typically. Are you potentially prepared to end up paying $200 to $300 or more per month years down the road? Now, if you stay healthy, then you can apply for a new Medicare supplement with a lower rate when your premium starts to get too high. Now, if you happen to be watching this and you're already on a Medicare supplement and you've had it for at least 4 years and you want to see if you can get a lower rate, then reach out to me. We'll do some shopping, see if you can get the same thing for less money. And in most cases, you can. The difference is when you apply after 65 and a half, you have to answer a bunch of medical questions. If they don't like the answers, then you can't get it. But if you happen to be watching this and you're on a supplement and you've had it for at least 4 years, you've seen your premium go up and you haven't changed it, then by all means, reach out to me and let's see what we can do. What can I realistically afford when it comes to Medicare Advantage? There are many zero premium plans out there, but almost all of them will have copayments. So can you afford potentially paying thousands of dollars out of pocket if you have a health issue? That's what you need to be careful of. You must pay attention to the maximum out of pocket depending on where you live and the plans available. They could be rather low or they could be rather high. It just depends. Do I mind some risk for reward? So maybe you're a bit of a risk taker. And then when you consider Medicare Advantage, here's what you want to ask. Am I comfortable with my overall health? And I don't mind some risk of dealing with copayments and potential pre-authorizations for the reward of potentially saving thousands of dollars in premiums over the year. If so, then consider a Medicare Advantage plan with good drug coverage and provider network and take advantage of all the extra benefits. And that's something that we can talk about as well. Next, would I like to use my premium savings to help pay for a long-term care plan? So Medicare doesn't cover long-term care. One of the things you want to consider when you're turning 65, if you don't already have a long-term care policy, is to look into possibly getting one. If so, then you can consider either a zero premium Medicare Advantage plan that will save you premium dollars and help you pay for the long-term care plan, or you can consider a low premium Medicare supplement policy. If that's of interest to you, by all means, again, reach out to me. If you have questions, if you need help, Go to my website, themedicareanalyst.com. You will find a lot of information on there about some of the things that we've talked about today. You will also find a couple contact pages where you can fill out your information and ask me to reach out to you, and we can schedule an appointment. If you happen to live within about an hour or so of Charlottesville, Virginia, and you would like to personally meet face-to-face at a safe, convenient location, then by all means, let me know, and we can probably work that out. So states I'm currently licensed in outside of Virginia: North Carolina, South Carolina, Florida, and Tennessee, with more states coming soon. So if you're watching from somewhere else, and this information certainly applies to just about every state, really, other than maybe UVA being in the network. If you do live outside of Virginia, and then let me know in the comment section below what state you are watching from, because as I see people respond and I see what states are the most popular, then those are states that I'm going to get licensed in. If you like the video and you have found it helpful, just click the like button. If you want more ongoing information, then please subscribe to the channel. And lastly, who might you know that could benefit from this information? If you know a friend, a family member, then please click the share button and pass the information on to them. So that's it for today. I hope that was helpful on how to pick the right Virginia Medicare plan, especially if you are turning 65. Thanks a lot, and make it a great day.